Silvana Molly lives with her 3 children in the Tagabe community in Port Vila, Vanuatu's capital and largest city. She became pregnant with her first baby when she was 18. Silvana struggled to help provide for her children. Like other girls in the community, she knew little about how to prevent pregnancies or even how pregnancies occurred before her first birth. It was considered taboo to discuss these issues.
Awareness, TV or some book or booklets, about some family planning. We never saw some TV inside Hemi or so on, and Mr. Mitaniram town now, or Mr. explaining myself and yes,
in Vanuatu, thousands of young women like Silvana have little to no access to information about sexual or reproductive health. Cultural taboos, religious barriers and attitudes towards women's traditional roles are only some of the obstacles that prevent local young people from learning more about sexual reproductive health. Half of Vanuatu's population is under the age of 20. This situation, plus a high incidence of teenage pregnancies, STIs, and a high birth rate will make the country's poverty level even more of a problem in the future. In the late 90s, the very popular One Small Bag Theatre, a community theatre group, performed a stage production involving over 70 members of the neighboring Black Sands community, a peri-urban settlement of Port Vila. At the conclusion of the production, discussions and workshops were conducted to explore ways in which One Small Bag Theatre could continue to work with the community.
One of the things that the community members suggested was for One Small Bag to set up a reproductive health clinic, mainly because they said they weren't accessing any reproductive health services because there were no services near their communities. As a result of that, discussions were held with donors and with the Ministry of Health, and we ended up setting up the clinic.
The Kum Pusim Hed Clinic was established next to One Small Bag Theatre building in Port Vila in 1999. Kum Pusim Hed, KPH for short, means drop in for a visit in Bislama, Vanuatu's lingua franca. The clinic provides information and counseling as part of its advocacy work, but it also provides testing and treatment of STIs, including HIV testing, distribution of contraceptives and counseling.
It wasn't an idea that was brought out from outside or an idea that was instigated by the Department of Health or by government, but it was an idea that came directly from the communities. And the important feature about the clinic was that it responded. It responded to the needs of people.
We find that most of the clients who come to access the clinic services, maybe few are well educated, but most of the clients are people who are not really educated and they are unemployed.
Silvana visited the clinic several times and now has the knowledge and access to contraceptives to ensure that she will no longer fall pregnant until she feels that she is ready.
Maskat planter res, mobile lokate first born first time lokate gote mi pikwan after sabe lokate wan arama. Bisa dekat wan nar begini ni bayan.
The KPH Clinic continues to engage the community in its work, both through its activities and through its governance.
We have a KPH Clinic committee, and the communities are represented on the committee. And I guess we also have a lot of work that we do in the communities with the peer educators going out to the communities, and we run workshops with the communities. So we keep that link.
One Small Bag Theatre now operates 2 clinics, one in the urban area of Port Vila and one in Luganville. Support for the clinic services comes from the Vanuatu government in the form of free supplies of medicines and contraceptives and general oversight. Also, donor agencies like Oxfam, AUSAID and the New Zealand Aid Programme and regional agencies such as the Secretariat of the Pacific Community provide vital funding and technical support.
I think they recognize the importance of reproductive health services in the urban areas, especially at the edges of the urban centres. There's a lot of peri-urban settlements that are further out of the main health centres, the hospitals. So our services cater mainly to the people who would find it hard to access government services.
Despite the success of One Small Back Theatre's reproductive health clinics and the need they are filling in the community, there is an ongoing debate internationally around whether it is appropriate for civil society organizations to provide public services, or whether they should focus on advocating to make governments accountable for providing services to its people.
It's quite a difficult and complex debate, but I think it's not either or. It's not service delivery or advocacy with government. It's actually a combination of a range of things. How do we work in supporting government and others, but also maybe engaging and advocating with government and others to ensure that they're putting in place policies and capacities to be able to deliver those services in the longer term?
I think that's an olden argument. I think nowadays we recognize that there is a need for a partnership in order to grow the economic growth and also extend services to the peoples. In our geographical locations, it's very difficult for government to do everything for these citizens. So therefore we recognize the role of the civil society as very paramount.
As a developing country, Vanuatu has many development priorities: building a stronger economy, providing education, protecting the environment, as well as providing essential health services for its people. For the government-run health facilities, though, there often aren't sufficient resources to provide information and services.
We really want to spend more, but I think really enough time from like plan with that side, so we really just take 5 minutes. Normally you should 10 to 15 minutes. So we really just spend them give him awareness no more every day, waiting room, antenatal matters. So every day we will start giving awareness of different reproductive health issues.
It would be fair to say that the government struggles to be able to provide adequate service for all its population. So with reproductive health services, I think the government has difficulty with the infrastructure, the manpower, even finance, to be able to give services at a standard that people would feel comfortable with.
In order for Vanuatu's government to try to fill the current gaps in its provision of reproductive health services that are currently filled by the KPH Centre and other NGOs, national leaders would first need to treat reproductive health as a higher national priority.
I think it will be very hard to see it happen if national leaders don't see it personally as a pressing issue and personally take the decision to provide that kind of service. So I think if it's pushed by outside organizations, it might be taken to a certain limit, but without that commitment, I find it difficult to see happening. One other issue that I think is also a critical one is just how the political system operates in Vanuatu. It's very much based on what leaders can provide to their immediate support group. That means that a lot of the resources that government provides is directed not for the benefit of the whole population, but to a specific group. And normally that means that basic services that everybody can access or should have access to doesn't get provided. And until that system changes, I see little chance of services such as reproductive health, but also things like water supply, education, other basic services reach people who need it most.
Because of this situation and the needs in the community, groups like KPH are compelled to provide services. Although this may be seen to be releasing the government from fulfilling its responsibility for service provision.
I certainly see that there's a role for civil society in service provision, But I think very much that needs to go alongside the need to be engaging government about their responsibilities and making sure that they see their primary responsibilities as the main delivery of services and that they are accountable to their citizens for that.
From One Small Bag Theatre's perspective, it's very hard for us to, or anyone, not just One Small Bag, anyone in society, to try and hold government accountable when the priorities are focused elsewhere.
Big man, congratulations, big man. Good look you for the chief. Yes. You say walk me must go ahead. Mr. Golo, one important meeting. Oh, big man. Also when I'm walk here. Wow. Walk you want how to walk the chief. Now you got all paper and master them all important paper down here. You say walk you. Big man, Mr. talk about walk.
Yeah,
yes.
all tram driver.
Oh, yes. Current boy. Political secretary. Yes. Ah, walk. Walk. End now. Chief. Yes. You look. Only tell him say Mimi one new for the minister no. Na mi no sabe kivi mo walk law supportable me. Every walk law say supportable terik na only take everyone. Government anyone coalition government. Lo make say got stability lo country mo lo government. Country big man. Why you sabe ki mo kyalo mi vela? Ah. You sabe 130 plus Steven Emi sick to us. He must come back like
Yeah. Everyone people are TV.
Willie, tell him. If all point below the string point back it.
Yes. Yeah. Look, me vole want them send me Kolo Island pay me vole no got money.
Yes. Issue paper money vole one. What time? Lo time blow love. Hey, big man, you look at church house millionaire. Church house ain't nothing is here. You sabe roof inoka. All wall blame. One no more istana bista. All man all ista pass the road all ista look church house here mo. Not to stop same ya big man.
Everyone big fella chief ya. Now every must Kolo Island. Suppose we take the place here by sas mo problem lesson them me go back.
Everyone small money no more. You be promised. Supposed to be promised by Nimega.
Ultimately, it comes back to the people of Vanuatu, and One Small Bag does a lot of advocacy work around that point. A lot of the theatre work that we do, the films, the radio programs that we do is to try and make people realize that as long as we are demanding our leaders to provide short-term benefits, we are basically selling out the future of our children.
One Small Bag Theatre also advocates with government by setting its clinics as standard bearers in reproductive health services. This is recognized by the Ministry of Health. As well as supplying the KPH Center with free medicines and contraceptives, the Ministry of Health also places government nurses on attachment with the KPH Center to improve their adolescent reproductive health knowledge and skills.
One really important something we Milan and people we help me local me counseling clients. Yes, so how you deal with them all kata, you talk to them all kata, lo set lo educate them all kata, lo set lo disease, especially lo STI infections.
In this way, One Small Bag has become a unique partner with government, filling a very special need in the community.
We send them over on certain attachment programs because we want them to learn on accessibility. Why do people access their clinics? And why not all government clinics, but certain government clinics do not perform at the same capacity. It reflects on the provider's accessibility, her meeting certain criteria that young people need when they go for services, and confidentiality comes in, the location of the facility, the friendliness of the service provider, both in the office and out of the office when she's out on the streets.
The KPH Center's provision and advocacy efforts are further enhanced by their close relationship with One Small Bag Theatre's other activities.
A lot of the films that we produce, the radio dramas that are done, focus on issues that the clinic addresses.
Have you come for a test?
I don't know. Tell me about it.
I can do a swab for STIs.
It is an integral part of One Small Bag. It still has very close links to the drama work that we do, the awareness raising through film and radio. but also the youth center. That's probably the newest part of One Small Bag. And we still try and link a lot of the youth activities back to the clinic to encourage young people to use the services at KPH.
Jerry and Natalie are a young couple who came to know about KPH Clinic through One Small Bag Theatre's Youth Center in Port Vila.
Yes, me outlaw young valana molol friend lo mi vilai stop then lista talem lo mi vilai cope lo mi vilai register town lo small park lo mi vilai sabe play lo la guitar or kolo hip hop then lo one time mi film say me want them check up so if been asking one friend lo mi vilai go
me before me come down, me no sabe se mi talem finis, me no sabe about me never sabe se olestia ya sambala li no ka treatment le ma. Be time mista kota no se mi just sabe na se sambala lo ta li sa treatim. Be sambala lo ta se hepatitis ol kita no sa treatim. Mo tu lo sa to kota family planning asem mi sabe se mi small family planning be all effects play me no really sabe good from the way we litalem since me past time knowledge play me kat me no say kat all effect play.
By coming to KPH, we have had time to explain to them how STIs are passed and the preventive methods and what to do if you having signs. So they always come to us. We let them ask questions that they want to ask, and when they leave this room, they are satisfied with the information that we have given them.
With its close links to communities, KPH continues to respond to the needs of people.
We are running a mobile clinic service because many of the women who come for family planning or for STI services were coming from outside of Port Vila and they were finding difficulty in funding transport to get in. Each community is visited once a month and the nurses and the periods stay in the community for half a day seeing people.
Apart from visiting communities outside Port Vila, the nurses also make a monthly visit to One Small Bag Theatre's Youth Center on the outer island of Pentecost.
We provide an option for a lot of the community members who, for some reason or another, feel they cannot access the services that are already available. We also have a reputation for keeping confidential information. Between 1999, when the clinic opened for the first time, and the end of 2010, we've seen just over 40,500 clients. I personally feel that if tomorrow we stop getting funding from our donors and we have to close down, that a lot of people will lose out and a lot of people will not access any of the services that they've been accessing here anywhere else.
Based on their experience over the last 12 years, One Small Bag's KPH Center and their outreach services continue to refine and modify their approach. This enables them to remain effective in the local community as needs and situations change.
One of the principles of the reform is that things that government cannot do it. It's better that they give it out either to a private sector or a civil society organization who can do more better than the government.
I don't think we want to produce a whole lot of KPH clinics across the country. I think we want to be able to maintain the clinics that we have and the standard varies for reproductive health service in Vanuatu. And as long as government requires the contribution from NGOs, and I think they will continue to require our assistance, we will continue to work with them. I think it's a partnership that's worked well for over 10 years, and I think it will continue into the future with the support of the donors, of course.
I think the donors and other development partners need to look at the real success stories, the outcomes, the results that KPH has demonstrated over the years, and I think they need to support such a great initiative for the people of Vanuatu.
Information's long line. We seek in you, KPH. You give him out tornadoes or preventions from me. You save him life from me. Or prevent